What and how do you define as musculoskeletal disorders?
The most important thing for me is to distinguish between the pain disorders as an expression of Qi stagnation and then the traumatic disorder with blood stasis and Qi stagnation. So these two parts of, so this would be orthopedics and traumatology. The trauma is, I divide into three phases. The first phase is the acute or absorption phases with mainly Qi or blood stasis. The second phase is the subacute or reconstruction phases with mainly tissue healing, like ligament, like muscle, like bone. And the third phase is chronic or rehabilitation phases, characterized by maybe blocked meridians, pain syndromes, internal or external pathogenic factors, scar tissue to treat, or functional problems.
How do you ascertain musculoskeletal conditions in your clinic?
So my diagnostic approach is mainly and first to listen to what patient is telling to me. That means to be very attentive even to small details, and especially about the first and very beginning of symptoms, because this description very often gives the deeper causes or makes clear the deeper causes of the disease. Then I observe his body language, every information I can get from his physical expression. Then, of course, my physical examination, that means to touch the pain zone with my hands, feeling meridian conditions, and so on. And last, of course, also the basis maybe for diagnostic, maybe the radiological examinations like magnetic resonance, ultrasound, X-ray. Magnetic resonance, especially for spine syndromes, ultrasound very often for ligament, tendine problems.
How do you determine a treatment approach for musculoskeletal conditions?
It's principally according to the TCM rule, leaf and root of a tree. So it means the leaf is the superficial symptoms like pain in a meridian or muscle or tendon. So the meridian level, and the root, which means is the deeper causes of the process and of the disease. That means the organs, inner organs, the emotional or soul status of person's behavior in daily life, the daily life condition and nutrition. So to understand the deeper reason of problems of patient.
According to your experience, what is the most important factor when you are treating these conditions?
Yeah, the most important thing is to, after making diagnosis, to have a very clear mind about the pathomechanism of the patient's conditions and the pathogenic pattern. Especially treating with acupuncture and herbs, you have to have your mind very clear. To choose correct points, correct herbal mixture, and when we talk about acupuncture, even the acupuncture effect of the same point will change if you are clear in mind about the processes in patient's organism or not. Then, secondly, I'm always looking for a multidisciplinary approach. That means, especially for pain syndromes and chronic syndromes, that means I try to involve colleagues treating with Alexander technique, osteopathic treatments, Trina massage. So especially for the orthopedic problems and the chronic ones, you have to have a multidisciplinary approach to resolve the problems of the patient.
And do you have certain herbal formulas, internal or external, that you use for treatment? And if yes, which ones?
Yes, I divide traumatology and pain syndromes, like I said, for orthopedic problems and sports. And in these cases, I use internal and external formulas. The internal formulas, which normally is 2 to 3 for every specialization, like traumatology, pain syndrome, sports. So normally 3 formulas for internal and 3 for external treatment is sufficient for daily work. So the internal treatment I apply when I have to tonify patient, or if I treat the root of the problem, so not the symptoms, not the leaf. And the external treatment is best to treat the acute situations and the meridian level, so the leaf. According to the leaf and root rule, the leaf level, first symptoms.
And what are the results in your clinic?
So when we talk again about trauma, then I could say maybe even 100% of positive results, especially if you start treating very early in the acute phase, in the blood stasis phases, with the Chinese herbs, externally applied, and massage techniques. Then you will have almost every case will be resolved. In case of the pain symptoms, maybe I can say about 70% of success, but it depends, as I said before, more if I'm able to find the correct diagnostic and if the patient is able to make necessary changes in his life and his lifestyle.